Some people with diabetes don't monitor their glucose levels. Why should people with diabetes monitor their glucose, and what should they do with that information?
Monitoring blood sugars is extremely important for everybody with diabetes. The number of times that you do it and the reasons that you do it are different based on whether you have type 1 diabetes or type 2 diabetes. But knowing what your blood sugar is prior to eating, especially breakfast, um, can help you to keep blood sugars in the normal range. If you start off in the normal range, then you can eat a breakfast that you choose. If your blood sugar is high before breakfast, then you need to avoid some of the carbohydrates that are typical in a breakfast. Choose eggs and maybe one piece of bread instead of cereal, milk, and toast, all of which have carbohydrate value. Um, and then if it's high, you need to think about, okay, what was it when I went to bed? Some people don't check that. A lot of people don't check that. But if blood sugars are consistently high in the morning, then knowing what it was when you go to bed will help you and your medical professionals to understand why it's high in the morning. If it's an occasional thing, then just treat it with a low carb breakfast. If anybody on insulin needs to know what their blood sugar is before every meal and when they go to bed, and add or subtract insulin. If blood sugars are low, then they're taking too much insulin or they're not eating enough carbohydrates to go with the amount of insulin that they're taking. So all of that is very important to know so that you don't have the tremendous swings from highs to lows to highs again that some people on insulin experience.